Carrie Vincent is your typical busy mom. But 18 months ago, without warning, she had a heart attack at age 31, just days after giving birth to her son, Griffin.
They told me that I had a 90% blockage to my left side.
The story is that Carrie suffered from a clotting disorder. A simple blood test warned her of the condition, but she never expected heart problems in her 30s.
When I was 31, I had a heart attack.
Now she's an advocate for women's heart health. She holds seminars to let women know the signs of heart disease and what tests they can take to prevent it.
Know your numbers and what they mean.
So what numbers and tests are important, and for whom? According to the American Heart Association, everyone after the age of 20 should have their blood pressure checked along with their good and bad cholesterol levels. And don't forget testing for triglycerides. Those are the fats in your blood that can lead to heart problems. If you're at high risk, meaning you're obese, a smoker, have diabetes, or a family history of heart disease, ask your doctor about a test that measures your LDL size. That's your bad cholesterol.
Some people, if you look at them, they have completely normal LDL numbers, but then you break down their LDL size. Okay, we find that they have small particles.
According to the National Cholesterol Education Program, the smaller the LDL particles, the more likely they will enter the vessel lining, increasing a patient's risk of heart blockages. Another test to consider, C-reactive protein. It's a marker for inflammation that can lead to heart problems.
Well, we think it irritates the lining of the blood vessels. And when you irritate the lining of the blood vessels, you allow the cholesterol, the plaque, to get inside the blood vessel.
Cardiologists say this test is a must if you have heart disease in the family. If you don't, you could probably put this one off. And if you're interested in those new heart CT and MRI scans hospitals are touting,
they actually look at the blood vessel and see if you've got hardening of the arteries.
Be careful, though. Although some scans can provide good information like coronary calcium scores, the American Heart Association warns, due to radiation levels, people with no risk should definitely think before having these tests. But if you have family history of heart disease, talk to your cardiologist to see if the scans might be right for you. You know, and despite multiple national campaigns, heart disease does remain the leading cause of death for many minority groups in the United States. Experts say cultural barriers could be a large part of the problem. So some physicians are getting creative to reach those most at risk.